Welcome back to The Light Within, Awakening the Inner Healer. I'm your host, Joan Jacobs. Today I'm talking to Dr. Mahesh Gandhi, an expert on the homeopathic treatment of psychiatric conditions. Dr. Gandhi, before the break, you were talking about how homeopathy is different from traditional psychiatric approaches in that it addresses the whole person and sees the psychiatric symptom as a symptom in a complex of a totality of symptoms. And I want to get into that more in depth.
Yes. So it improves the quality of life. It is like you get more connected to your spiritual side. Though you're not treating the person spiritually, but when you remove all the obstacles in the way and the person lives and becomes very harmonious within, then he starts having a sense of well-being. And this is one of the things which is very important. When we say what is health, health is not just removing symptoms and pain, but also having a sense of well-being. And this we can create with homeopathy. And this is important because sometimes we treat these depressions, anxiety with drugs, and the patient is sedated, he has so many side effects. So he may be without depression, but there is no good quality of life. He does not feel nice inside. He's just symptom free. So I have been treating now last so many years. I am practicing last 25, 30 years, and I've been treating a lot of cases, as you mentioned, anxiety, depression, schizophrenia, bipolar disorders, and a lot of children cases. And I'm very happy that today, whatever I'm doing, I'm very happy because I see those results and I can see those smiles on the patients' faces. And when I see that, it's really it's very rewarding because you really feel that you have helped the person, because you really see a complete change in that individual, the way he looks at life and the way he's more connected to himself much deeper. Now, when you ask me whether how I treat and how it is different from other things when we treat in homeopathy, basically we treat the person. So we do not have super specializations as we have in medical field. We don't have a homeopath who is a gynecologist or just a gastroenterologist or a pediatrician or a psychiatrist. We treat the person. So there is no specialization. So if you can treat skin disorders, then you are equally equipped to treat asthma, and you are equally equipped to treat schizophrenia and psychiatric disorders.
But with that, wouldn't you say that dealing with psychiatric conditions does take a knowledge and expertise? I mean, you have to know how to work with these conditions.
Yes, that much. You have to have some idea about what is psychosis. You have to have some idea about these various psychiatric disorders. But that is not the most important thing. Okay. What is important is how do you understand the patient? How do you see the person behind the one who's suffering from obsessive compulsive disorder or who's suffering from depression? If you understand his problems, where it is coming from, if you really know the person, and which I think a good homeopath, whoever he is, will know that, then he should be able to treat. Of course, I am very lucky because of my psychiatric background. I got more patients in psychiatry. I got more psychiatric cases whom I'm dealing with. And so I got more experience with those patients. So my psychiatric background did help me. But finally, it's an art, and you have to understand that a lot of things which I'd learned in psychiatry, I had to unlearn, because the whole approach to homeopathy is very different from what approach it is to allopathy. In fact, it is just the opposite. Sometimes it is as different as science and religion, which cannot meet eye to eye at times. Because homeopathy is related to the left hemisphere, a right hemisphere of the brain. So when we treat somebody from the right hemisphere of the brain, it is more like it goes with philosophy, more with religion, more with holistic sciences. It is seeing the person as a whole. So the left hemisphere is what we are dealing with most of the time. The modern medicine functions from the left hemisphere, which is the scientific mind. So what happens is, when we function from the left hemisphere, the left hemisphere does not know the language of the right hemisphere. So there is a lot of controversy around the world. It is the controversy of science and religion. They cannot understand. It's a completely different way. But we cannot say that we can function. Can any one of us say that we only want one hemisphere of the brain? We only want the right hemisphere, only the left hemisphere. The whole idea is that we have to bring both these two together. Allopathic medicine, modern medicine definitely has its place. It has its place in crisis intervention. Let's say there is a psychotic patient with a gun in his hand and is ready to shoot somebody. It is best that we catch hold of him, grab him, and just give him a shot of some sedative and put him down. I'm not going to wait and give him some pills for him to calm down. Mm-hmm. But when you continue giving those same injections, same sort of medications to an individual for an extended period of time, then there is a problem. Because for years together, then he'll be getting only those medications. So allopathic medications, modern medicine, I think has a lot to do with crisis intervention. Anything which is acute and there's a crisis, I think it's of a great help. And one should resort to it and there is no harm. We don't have to fight that this is right or this is not right. But in the long run, I think if we have a more deeper approach, trying to understand the patient, go into his shoes, see how he sees the world, I think it's more human, more deeper. And the patient also appreciates this approach. And when he sees some good feelings and when his medications start going down, I think we have to marry these two approaches. The problem is we have to always making choices. Is it this or is it the other one?
Well, I wanted to also ask you, there's, to my understanding, and I'm far from being a psychiatrist, but to me it sounds like there's a difference between being in depression or having schizophrenia, which is sort of an ongoing condition, versus having panic attacks, which is something that sort of comes and goes.
Right.
Is there a difference in the approach to the treatment of these two different types of conditions?
Approach sometimes is different because a panic disorder would be what one would call, previously it would be labeled as a neurotic disorder. And schizophrenia would be what one previously would have been called a psychotic disorder. One is a minor psychiatric disorder, one is a major psychiatric disorder. And what is the difference? In minor psychiatric disorders, the person is aware about his illness. It's like if you have panic disorders, you go to a psychiatrist and tell him that, see, I'm getting these panic attacks and I'm very disturbed. I feel I'm going to die any moment. Or if you have depression, you go and say that I'm feeling very depressed. There's no enthusiasm. I don't have any interest in life anymore.
Okay.
Or if you have obsessive compulsive, you go and say that I have these compulsive thoughts and I have these repeated compulsion to do these repetitive actions. But in schizophrenia, what happens is there is an ego breakdown. He loses his contact with reality. He starts seeing things and functioning from a different point of view altogether. He doesn't believe anymore that he has any illness. He feels he is normal. And so he will never come to a doctor for treatment. So it becomes very difficult to treat him because he feels he's all right. All the rest of the people in this world are the ones who need treatment.
Oh, great.
So what happens is the approach is very different. One comes to you for treatment, whereas somebody else, very often they don't come.
Yeah.
So then in case of psychotic disorders, what we have to do is call the relatives, talk with them, and then we are not just happy knowing that he is schizophrenic. But we would like to know what exactly are his delusions, what is he thinking, how is he functioning, how he perceives the world. So try from those symptoms, see his perspective, see how he sees the world. So sometimes we also take history about how he was before the illness began. Idea is not to be satisfied with just knowing that he is schizophrenic, but understanding the person who has got this schizophrenia.
So actually what you do is you take each of the psychiatric conditions and individualize them.
Exactly.
And each patient would probably get a totally different remedy based on the individual profile that you create.
Yes. But what happens is, over a period of time, now with my clinical practice and my experience, I know who are the type of people who can break down. So it is very, very interesting because I'm seeing certain patterns And this is exactly what I'm trying to do now, write a book so that people who have not so much of experience with psychiatric disorders will be helped by that book. So I'm trying to write the whole of psychiatry from a homeopathic perspective.
So what you're saying is that the development of psychiatric conditions could be, you can see that before they appear?
No, not that. But we know we can even know beforehand that but I think even the psychiatrists know that somebody with a schizoid personality, there are certain types of people who can be predisposed to psychotic disorders. But
so it's almost like predicting.
Yes, not necessarily, but we know that some people are more vulnerable. They are more, they can break down easily with stresses because they don't have so much of ego strength. But from homeopathic point of view, when I say we also can predict certain patterns or remedies which could probably help these type of people.
Well, on this note, Dr. Gandhi, we're going to take our second break. Okay. We'll continue talking right after the break. People, stay with us. We'll be right back.